So when it comes to your head and neck and your posture and stuff like that, I think what we're dealing with is exactly what you said, right on the nose. It's a lot of postural dysfunction. When you had that tension and tightness in both your shoulder blades, like right through here and right through there, and especially on the right side, you definitely had more tension on the right. Because remember, I bent your neck down, and you started to feel it like run down on both sides of the back. But when I kind of bent you to this side, you felt more of a stretch on this side. When I bent you into this side, you felt a little more tense. I can tell you, not only did you feel tense, but your movement was not as good. And you probably noticed that like doing stuff like this or looking over the right side is a little bit harder. So what I think is happening in that area is that you're getting a lot of compression. And I bet you if you do this, you'll feel a lot more. And ready?
Oh, yeah.
Yeah. Yeah. So what happens is that with time and just life in general, what happens is these little nerve holes get compressed. So if you see these nerves, and we can see them on the side of that spine over there, they come out of that area. They kind of come out like this. Like that. Here are the nerves that come out. What can happen over time for age, compression, working too much, not taking care of our body, whatever it may be, you can get these two areas that get compressed. And what happens is that it can put pressure down onto the nerve that comes out, right? In your case, because I saw this was happening, what I did next is kind of pull on your arm, I pulled on your neck, I pulled on certain different areas, and I went like this to see if I can irritate the nerves. Good news is I could not. There's no numbness, there's no tingling, there's no sharp shooting or stabbing pain that goes down into the arms. Because sometimes when you get a pinched nerve in the neck, and I don't know if you've ever had this or know anybody who did, that's probably the number one condition I treat is pinched nerves from the neck or the low back, like sciatica. These pinched nerves can go all the way down into the arm, right? So if you pinch it all the way up here, let's just say, for example, like right there, it's going to run all the way down into the arm. I pulled on your arm and I tried to tug it down on that nerve, and I could not make that happen. So congratulations, that's good. The thing is, remember when I looked back, you said it felt better? There's a reason for this. With time, the average weight of the human head is roughly 8 to 12 pounds. So let me pull this down. Roughly. So what we do is we kind of draw a line that goes like down from our ear through our shoulder and all the way down, right? That's like a straight line. Now, if you notice our curve here in our spine, there's a small little curve here. That helps support the spine. It's almost like doing this, like a tray, right? Because if we hold the tray like this, it's going to fall over, right? Or it's hard. We hold a tray like this, it sees like that little C shape. That's what provides us with that curve. What's happening to your posture is that when we have bad posture, our posture goes forward, right? So now the weight of our head, instead of it being here, is over here, and now it puts like way too much pressure. So let's just say our head's over here. Let's just say this is our ear. Now we put a lot more pressure back here, and all these muscles have to start working harder. So when I put extension back into your neck, when I did this to you, it actually helps increase that curve again and helps align things a little bit better. So to say this simply is you're having your head slowly go forward, and that's putting a lot more strain and tension on you. That's why short term you're getting relief, long term you're not getting much relief, because you're stretching out these tight muscles, but they're tight because they're working harder. So if we can bring that neck to try to bring it backwards a little bit and just shift it from, like, let's just say here to here, look at the difference of where the spine would be, right? It would be back here versus over there, for example. So obviously this isn't true diagrams. Now, nobody's going to, in my opinion, you're not going to massively change your posture in one day. It may take some time. There's going to be some exercises that I recommend. I know you're really busy right now and you're working your butt off. So you don't need to do a lot of exercises. I just think you need to do a few. And a few done daily or weekly or a couple times a week might be a big difference in your posture and how you feel. If you don't have to spend a half hour every day, if you spend like 5 minutes, once a day, or 10 minutes or 15 minutes every 2 days, so that meaning 2 to 3 times a week, it might make the biggest difference between Because the difference between like pinching a nerve, for example, and not pinching a nerve could be literally like a millimeter. So you can literally be close to pinching a nerve right now. I don't know. You could be very far away from it. I don't know. But I can tell you that if you're feeling pain and discomfort and you get relief of this, every time I move your neck and head, you felt like either better or worse. We know that means it's, and it kind of goes down into the mid-back. We know it's coming from the neck. Okay? There are nerves that also go down into our shoulder blade here from our neck, so you can kind of see that. And I think that's one of the reasons why you're also feeling that pain within the shoulder blade here. And when you look down, you kind of feel the tension that builds. So as a chiropractor myself, what I'm going to focus on is trying to help you with your posture, adjusting you, aligning you, really restoring that curve, giving you exercises that help you, that are specific to what we're doing in the office. And then I'm going to help you with relieving some of the tension and the pain as well. I wouldn't call it necessarily pain, but discomfort. So I do a lot of soft tissue work. I do a lot of manual work. I am, by definition, I don't know if you looked me up or looked up a lot of stuff. I do a lot of manual therapy, a lot of manual work, a lot of hands-on work, which really means, yes, I do adjust you, but at the same time, I do a lot of soft tissue work to help release some of the tension. So I'm not going to work on, like, you know, your bicep if it's not a problem. I'm going to work on the shoulder, the neck, the chest, open you up. And so, you know, maybe help you with your job and stuff like that. So it takes pressure off of you. You are working a lot, so, you know, it's kind of like that's our barrier. You know, that's kind of like, but that's a good barrier to have, I guess. Right?
Yeah, no, it is.
You know, any questions on any of that?
No.
Cool.
What about well, maybe the same thing, like the tension that I feel sometimes here. Then I have to, like, if I go like that, it kind of feels good, you know.